Yes, Anusree is a junior psychologist in Pallium India Trust. She is a postgraduate in psychology, and Anusree was associated with previously a school, and currently she is associated with our Pallium India from last 6 months. So over to you, Anusree, for the class.
Thanks, somebody, for your kind introduction. Good afternoon, everyone. Thank you all for being here today. So today we'll be discussing about some basic concepts in communication. Okay. First. Okay. Okay, as professionals, we'll be communicating with other professionals, and it is important to communicate with other professionals. Communication is a team sport. So if you don't communicate with other team members, whether it can be social officers, doctors, nurses, even a pharmacist, whether if we are not communicate, not good, if you don't have a good communication with other professionals in our team, it will not be a not be good. And also we'll as professionals will communicate with family and with patients. In western countries and all western developed countries, the first communication happens with the patient, then only we'll communicate with the patient knowledge, only will communicate with the family members. But in Asian countries, like as in India, we'll first communicate with family. With family's knowledge and family support, only will then only will move in communication with the patient. Next slide. Next. Okay. What is patient satisfaction? If a patient comes to us and we'll be having the best of, we'll be giving the best of medical treatment, we'll be having the best medical skill, and will be providing them with the best nursing skill. Will the patient be satisfied? Will that make the patient satisfied? Uh, I expect this to be an interactive session. I'd like to have your comments. Will our best of the nursing care and medical skills, will that make our patient satisfied? That was a question.
No, ma'am. No, ma'am.
No. Then what will make the patient satisfied? What we have to do from our side to make the patient satisfied?
Ma'am, good communication and listening to patient.
Yes, obviously, good communication. We have to have good communication skills, and we have to listen. The sense of trust or the sense of satisfaction comes from the feeling that the patient is being listened to. If the patient gets that feeling that they are being listened to, we have been listening to their concerns, their problems, that makes the patient satisfied. And with the good patient satisfaction, we get a good relationship between the patient. Okay. If we are not properly communicating with the patient, the approximately 60 to 70% of medical errors happens because of lack of or poor communication. If we communicate with the patient and the family well, the medical errors can be prevented. All the medical errors can be prevented previously. Okay, and also if not only the medical errors, the lot of financial issues also happens when we are not communicating properly. Financial issues in the sense, if there are a lot of cases that happens if the patient goes for legal things. They are filing cases against hospitals and doctors. Also, if we are not communicating properly, the patient will opt to another hospital and go to another doctors, and that in that ways also that becomes financially expensive. And a lot of financial issues also happens because of poor communication. That can also be prevented if you are communicating with the family and patient well. Okay. Why do we have to have a good patient and doctor relationship? If you have a good communication, if you have a satisfied patient, if you're having a good conversation or a good communication with the patient, the diagnosis or the history taking will be easy. the patient him or herself will be opening up to you. They'll be telling you all their issues, all their concerns, all their problems. By that you will be having you'll be having a good history taking, and good history taking leads to diagnostic accuracy. And if diagnostic accuracy also, and the patient is will be compliant, they'll be have a sense of trust with you, and the patient will be satisfied. And if the patient is satisfied, our hospital management, our team will be satisfied, and it leads to patient safety. And there'll be low chances of getting any other issues, any legal issues. And in this ways we can also make use of good communication. Okay, why do we need medical communication? What is it for a patient? What is, as professionals, why do we need medical communication? I hope you can put your comments in the chat box, or you can mute yourself and speak. So why do we need medical communication? What is in it for patients, and what is in it for us as professionals? Why do we need, as professionals, why do we have to do medical communication?
मैम अगर हमारा गुड क्लिनिकल मतलब मेडिकल कम्युनिकेशन होगा पेशेंट के साथ, तो वो अपनी नीड्स को, अपने
Hmm.
सिम्टम्स को बहुत अच्छे से हमें खुल के बता पाएगा। उसके
Yes.
हिसाब से हमें क्लियर कट डायग्नोस बनाने में हेल्प मिलेगी। वो हमें फॉलो कर पाएगा बाद में अच्छे से, तो कंप्लाई ऑफ पेशेंट भी इजी होगा।
Yes. Okay. What's your name, ma'am?
डॉक्टर लक्ष्मी।
Okay, you have said it correctly. And also, we need medical communication for decrease the uncertainty. If the patient will be having lots of hopes, and if you don't communicate properly, there'll be always be having uncertainty. What is happening with me? Why is it paining? There'll be lot of questions in the patient's mind. So if you don't communicate properly, the questions will be there unanswered. And also, all of us, we don't won't be having health insurance and all, right? If we communicate properly, the patient and the family will be prepared for what is happening. They'll have that time to take preparation for mentally and physically for what is happening next, or what can I do if this happens, what can I do. Then they can prepare mentally and physically. And also, as professionals, this communication also, as professionals, are also needed. Because uh, as professionals, we'll say that they have to be have a good communication with other professionals to refer the clients. We don't there is not we don't have to know everything. So there will be certain uncertainty within us also. So to clarify this, we need to communicate with other professionals. And also to increase our achievements. If a patient, our patient tells some other person that this so and so person was so good to me, that is a good remark, and this again is an achievement for our career. In that way also, it is important. And why is medical communication is challenging? Why do we have to, why do we face it? Where do we think that is difficult? How is it become challenging?
मैम फर्स्ट ऑफ ऑल तो शॉर्टेज ऑफ टाइम, कि हम हर पेशेंट को बहुत ज्यादा टाइम नहीं दे।
Mm. Yes, there will always be time shortage from patient, and also from our end also. Will not be having time. That is a relevant point. Then, okay, is it from the starting itself it is negative? It is like a patient comes to us because they wanted to, not because they wanted to come to us. They are kind of forced to come to us. If we are going for a movie, or if we are going for a picnic and all, there will always will have a choice. If you are in a mood for that, you can do it. Otherwise you don't have to do that. But when you're going to a hospital, yeah, you have to, if you are sick, if you are not feeling well, you have to go to see a doctor. So from the starting itself, it is negative. That's why it is that way. That is why we perceive it as that much challenging. Okay. Is there anything that you have to ask or anything? Okay. Barriers of communication. What can all be the barriers for an effective communication to happen? Uh, someone said before, like the time is a barrier. The patient and the both the patient and the professional should have that time for sit together and to build a rapport. The time is needed. Time can be a barrier. What else? What else can be the barrier?
मैम जैसे हम पैलेटिव केयर के रिगार्डिंग अगर बात करें तो ये भी बैरियर है कि हम पेशेंट को उसकी सिचुएशन बताएंगे, वो अपसेट होगा मतलब जान के, तो इसलिए शायद हम ज्यादा खुल के नहीं बता पाते.
Yes.
Hearing loss, ma'am.
What?
Hearing loss if patient is deaf. It is also act as barrier.
Okay, yes, that can also be a barrier. That is patient as barriers. Like as someone like Dr. Lakshmi said, if, that is because as professionals as being the barrier. If we don't know, we are not trained enough. Like if some we communicate a bad news, or if we communicate something with the patient, what if the patient we don't know how to react about if a patient started to cry, or if the patient gets angry, we don't know how to react to that. That is a barrier. And patient as barrier, if yes, if a patient is deaf, that is a barrier. And also if the patient has stroke, it is a stroke patient, and you don't know how, if we having this it is dysphasia or dysarthria, that is a barrier. And also if when we communicate to patient, the answers are given by family members. We are not getting a chance to get into the patient. The family members are talking for the patient. That can also be a barrier. And sometimes patient itself can be a barrier. Like if we go to them, and if they first of all they are coming to us forcefully, and also our appearance, we go to us wearing masks, our step and appearance, our uniform. If they are not scared, they'll be they are less comfortable around us, right? So we have from our end, we have to make them comfortable. And also if you are not smiling, even though we are wearing a mask, and if you're not smiling, what do the patient think? Will they open up to us? No. Will they open up to us?
No, ma'am.
No. Okay. So this is be a patient as being barriers, and also environmental barriers. And there will be privacy issues. We'll be in a busy OP, so there'll be patients coming and going, there'll be nurses, there will be very busy. And in between that, can we effectively communicate with the patient? Sometimes we can't we can't make an atmosphere, we can't make a situation where the patient can effectively vent out or share their concerns. We don't have that situation. We have to come it means we will not be having that privacy. So if we can still create an illusion of privacy, like putting the curtains and all, we can create an illusion that there is privacy. Then some issues we have to learn to live with that. Some barriers, some barriers we can change. Okay. Okay. Active listening. What is the difference between hearing and listening? Hearing and listening. What is the difference? I can hear you. Like, what is the difference? Is anyone there would like to share what is the difference between listening and hearing? You can also comment on the chat box also.
I'm listening with focus and only just not paying attention. is the
Mm.
difference between listening and
Yes, hearing will be like passively hearing. It's just someone will be saying and will be just hearing that. But in listening, will be there. It will be listening like will be perceiving the information, will be interpreting that information, will be comprehending that information, and will be reacting. If you are listening to a person thoroughly, we'll be reacting to it. That is the difference between listening and um, hearing. In a palliative care setting, we may not be having we not be having anything to offer. Sometimes the patient will be coming to us and will be sharing their concerns, problems. This many issues I have. What I will do. So many times we'll not be having a solution, or will not be we ourselves will not be, we don't know how to console them. In that time, the only thing we can do is listen to them. Listening itself can be very therapeutic. If the patient gets, as I said earlier also, if the patient gets a feeling that they have been listened to, that creates a sense of trust. Then their half of their problems will be reduced. That happens. And I'm being a psychologist, I've been in this kind of situations for many times. Like they'll be very stressed out, especially for caregivers. They'll be like very stressed out, they'll be having many problems, they have to be at the bedside. If the patient will be in the bed, but the caregiver also have share the same kind of burden. They have from the diagnostic, when a patient bonds, same time the caregiver also, and 24 into 7 they have to be with the patient. They'll they have to be there in every ways. So that burden, they won't be having a space to vent out, to share their concerns. Everyone will be asking with patients, how are you doing, what are you going through. Everyone will go and ask with the patient. But what about the caregivers? They are also going through the same kind of pain. They'll not be having, they can't talk to the patient about their concerns, because already patient is concerned. Being that in that stage, the caregiver can't go to patient and tell their concern. So they'll be holding everything. Everything will be holding into their mind. So in that kind of situation, we go to caregivers and we'll give them a space to share their concerns, to vent out, to share their problems, concerns, everything. So then they get a sense that I've been listened to. There are someone who is actually there to listen to me. So this creates that this itself make a therapeutic effect in caregivers, and also with patients also the same thing happens. Yes. Okay, body language. Are we aware? Is it important? Is it really important to have a good body language? What is the need of having a good body language? Is it really matters?
Yes, ma'am.
How? Dr. Lakshmi, I would like to know your comment on that.
मैम जैसे हमारी बॉडी लैंग्वेज, मान लो पेशेंट हमारे पास बैठा है, वो
Mm.
बहुत पेन में है अपनी, वो बता रहा है और हम स्माइल कर रहे हैं उस सिचुएशन में, या उसका मतलब जो प्रॉब्लम है वो हमें पता है कि भाई वो लाइफ लॉन्ग होने वाली है, वो बहुत उस डिस्ट्रैक्ट है उससे, और हम हंस रहे हैं, या हमारी बॉडी लैंग्वेज जैसे हम मतलब उसकी तरफ आई कांटेक्ट नहीं कर रहे हैं, इधर उधर देख रहे हैं, तो पेशेंट को फील होगा कि हम उसको अटेंशन ही नहीं दे रहे हैं। मतलब वो इफेक्टिवली कम्युनिकेट ही नहीं कर पाएगा अपनी प्रॉब्लम को, अगर हमारी बॉडी लैंग्वेज ठीक नहीं होगी तो।
Yes, that's very correct. The patient must get must get the feeling that this person who is sitting next to me is interested in me. He's interested in what I am talking. He's interested. He's concerned about me. The patient must get that feeling. For that, to patient get that feeling, we must have to have that good body language. Approximately 55% of our communication is done through our body language. If we are sitting in as shown this picture, if we are sitting or standing like this in like this posture, would the patient will be interested to share his concerns? No. So it is good to have, it is good to have, it is very important to have a good body language. Yeah, as I said earlier, this is a model by Albert Merbian, and which says 55% of our body communication done through body language, and 38% is done through voice and tone, and only 7% is done through our spoken words. So it is okay. Then Next, how can we be better communicators? These are some positive body languages that we'll be discussing in detail. Eye contact. Okay, eye contact is a first conversation that happens between two persons. If a patient comes to meet us in the OP, you have to look at his or eyes. Then that is the first conversation that happens between you two. Starting from that, when the patient leaves, till then you have to look at their eyes. That is very important. Maintain a good eye contact. I'm not telling to stare at their eyes. It's not like that. But if you sense that it is making the patient uncomfortable, you can look somewhere else, like in the face. You can spot. You look at somewhere else in their face only. So do not look down when you look away. And also, if the patient is telling something, and if you can just close your eyes, and you can know that all these things encourages the patient to talk more, to explore. This also facilitate your exploration. Yeah. And smile. Why do If you're wearing a mask also, why do we have to smile? If I'm wearing a mask, is it important? Is it relevant to smile behind a mask? Do we have to do that?
यस मैम, बिकॉज एक्सप्रेशन तो फेस पे दिखता है कि हम स्माइल कर रहे हैं.
Yes. If you are smiling, that smile is seen in your eyes, and also it can be heard in your voice also. It's like we'll always otherwise also all these things, the mask after corona also, the mask is very compulsory, and mask, the state, and our appearance, that itself making the patient uncomfortable. From adding to that, if you are not smiling, the patient will be very scared or less comfortable. So it is important that you smile. Even if you are wearing a mask also, smile. It can be seen in your eyes, and also if you're smiling, it can be heard in your voice. And tone of voice. It's, as I said earlier also, it is how we are, how you say it matters. If you're talking to the patient, how you say it matters. Always use a gentle, calm voice, so that the patient will be calming down. Body positioning. What can you understand from these pictures? What this picture saying? This first picture, a patient is lying down and a doctor is standing behind, next to him. What can you make out from all these pictures? Can anyone else take initiative and talk? Dr. Pradeep.
Positive body language.
Okay. Or what is it? Positive?
Positive body language.
Positive body language. The first one you're saying. All these pictures shows appropriate body positioning.
यस मैम, जैसे कि लास्ट वाले पिक्चर में चाइल्ड है, अगर हम उसके सामने ऐसे स्ट्रेट खड़े होके वो करेंगे तो वो इफेक्टिवली नहीं कर पाएगा. लेकिन इसमें डॉक्टर्स जैसे बच्चे के साथ बड़े उसके साथ ईज आके नीचे आके उसके साथ मतलब चाइल्डली बिहेवियर में पूछ रहा है, तो वो इजीली उनको डेमोन्स्ट्रेट कर पा रहा है, दिखा पा रहा है.
Yes, that is very important. Like if we are talking to a child, it's important that we goes down to their level. We have seen like we are bending in hip. Which one is good, on your knees, or bending in hip, bending in your hip level, or bending your knee level? What can be done with children? I'm asking.
मैम क्वेश्चन नहीं समझ आया.
What?
मैम क्वेश्चन नहीं समझ
Okay.
आया.
With children, do we have to bend in a knee level or a hip level? Knee. Okay. Dr. Preeti Yadav says knee.
Knee
Yes,
level.
yes, it is
Knee
important.
level.
Then only we'll be, will be reaching their level. And also, if the patient is lying in the bed, so it's not appropriate if you ask to talk to them standing. And if a patient is lying, you just pull out a chair and sit in the bedside. Yes, yes, it makes kids friendly. Yes, it is. So if that creates, as I was speaking, if a patient is lying down, it's important you also, as doctor, nurses, whoever you are, you pull out a chair and sit next to the patient. It's important that is you are on the same level. If the patient is lying down or sitting, you also have to sit. If the patient is standing, you also have to stand and talk to them. And this wise body positioning is important. That creates a sense of equality. If the patient is lying, like sitting, and you are also sitting them with them, that creates a sense of equality with you and your patient. Okay. Body posture. what what is the difference between these two pictures that I've shown? The first person is put his leg on the table, and he's sitting comfortably. And this girl, what is the difference between these two pictures?
एक रिलैक्स पोस्चर में है और एक अटेंटिव पोस्चर में है.
Yes. And if you're sitting with a patient like this, will the what the patient will what the patient what the patient will feel?
मैम पेशेंट अपेक्षा करता है कि एक अटेंटिव पोस्चर में उसकी मतलब प्रॉब्लम सुनी जाए.
Yes, that this makes the patient will get the feeling that this person is not interested in me. This person is not interested in what is my concerns are. So if it is important that the patient get a feeling that this person is interested in what I am speaking, and good body posture adds to that. If the patient, if the us professionals are interested or not. Yes, good posture makes a good communication. These are all added points to have a good communication skill. Okay. Leaning forward, as I was saying, it is important if you have to show interested in other person, to show interest in other person, to show interest in the patient, to show interest in the patient, to lean forward towards them. If we are seeing a patient and we are sitting, we are leaning back, and we are sitting in a calm position, and that the patient will not get that sense of satisfaction or sense of trust within you. So it is important that you when you are communicating with your patient, lean forward and ask their concern and explore more. Always keep an open posture. Do not cross your legs. Do not cross your hands. It makes the patient resistant to what you're asking. So always keep an open posture and lean forward while communicating with the patient. Yes. Everyone will be having just a boundary, personal boundary. Everyone will be having that, and as well as the patient also. It is important that we respect and maintain that personal boundary. We having intimate space, personal space, social space, and public space. So it is important that if the for patient also are having all these things, so it is important that we respect and maintain their personal boundary, personal space. Okay. What is the difference between these two pictures? We have discussed how to sit, how to make our body posture, communication, and all. So, what is the difference between these two pictures? What Did I make it clear?
मैम
Yeah.
फर्स्ट पिक्चर में तो जो डॉक्टर है वो नर्स या डॉक्टर जो भी है वो थोड़ा मतलब एज ए मेडिकली उनसे बिहेव कर रहा है कि उनके सामने मतलब पेशेंट के सामने एज ए प्रोफेशनल वो हो रहा है कि वो बता पा रहा है। सेकंड पिक्चर में वो बहुत फ्रेंडली उनके साथ मतलब गुड स्माइल के साथ अच्छे उससे कम्युनिकेट कर पा रही हैं तो पेशेंट इजी फील करके आराम से उन्हें बता पा रहा है।
Yes. Okay. Can you open the chat box? Okay. And this Anu Bonwal was saying in second patient is comfortable, and yeah, most of them are saying in second picture the patient is more comfortable, more friendly in nature, and it is easy to communicate. And in first picture, where does the communication happens? Where are they? Are they in a private space? Can anyone look at the patient face in the first picture? The
यस
Yes. That's in first picture, communication happens in a corridor or something, right? And look at the patient's face. He's scared. And what is the doctor doing? He's standing, and the patient is sitting. And it is not equal. When we are talking to the patient, it is important the patient is sitting. We also have to sit, and that creates a sense of equality. And here the doctor is standing and the patient is sitting, and the patient looks scared. Yes, Sonia Kumari is saying in the first picture, patient thought that doctor is scary and his way of communication. Yes, it is. And also, look at the next picture. The patient and the health worker is sitting in a bed, and both are in a calm. Both looks very calm, and this health professional is smiling at the patient, and patient also looks calm and quiet, right? There happens a better communication. This is how you have to posture your body while communicating with the patient. Yeah, next. Okay, touch. Okay, if after corona we are not touching each other, like this touching is very therapeutic nature. If a patient cries in front of us or share his concerns, it's important that we touch, take his or her hand and console him or her. It is very important. And if will be having, you can also use this gloves and all, and also you can use sanitizer in front of the patient also, but make sure if you touches the patient, that consoles them, that itself make a sense of comfortability, a sense of calmness in the patient. Okay, now is there any doubts? Okay, I will be moving to next session, like some verbal do's and don'ts while we are communicating with the patient. What can be done, or what should not, what are the things that we have to avoid. And so you always keep in mind that do not ask leading questions. Always ask open-ended questions. Like if you are going to patient and asking, like, your breathlessness is better now, isn't it? Your pain is better now, isn't it? It is a leading questions. We are leading to the answer. We are leading the patient to the answer. You have to say that it is better. That is a leading question. So instead of that, you can ask, how are you today? How are you feeling today? And also, if the patient is an well exposed patient, they can say, if your medicines are not working, I don't have a better, I don't have pain relief. If the patient is well exposed or well empowered, have no more knowledge, they can say that, I don't have any pain relief. What if the patient is a layman, who don't know anything about your medical things, and who don't know anything, who have that fear factor in their mind? So how they will respond to that? They'll always say, I'm better. They don't know how to say no. And if a qualified doctor comes and asking, your pain is better, how can they say no to that? So it is important that always ask open-ended questions, and avoid questions like that starts with why. Why questions can be avoided. Yes, and also, we don't have to compare or minimize the problems of our patients. For them, their problems are the world's biggest problems. They'll be thinking of they'll be thinking of their problems all every day. So when we are going and just look at the patient in the next bed, he's having more problems than you. His pain is very higher than you. What if we are going to a patient who thinks my problem is the biggest problem, and telling that you don't have anything? Then look at the next patient. What the patient feels that time. This is just a small pain. There is no other complaints. You don't have to worry about that. Do not maximize, so do not minimize their problems, and do not compare the one patient's problems with other patient's problem. So what you can do is always always normalize how patient's emotional experience. Instead of normalizing their problems, you can always normalize their emotional experience. Like, considering what you're going through, other people who are going through the same situation must be feeling the same way. It is normal to feel that way. Or not the You have to normalize what the emotional experience, not the problems. Okay, and also you don't label. There's a VIP patient in row number 102. Do not label patients like that, and also do not judge your patients. Let's just say that this patient is very irritable. He's very angry all the time. But if you don't know, or you don't know what is going on with their life, so do not judge or label the patients as like that. Also, it is for giving false hopes, saying that you don't have to worry, we are all here. Can we do that to if a patient who is having cancer? Can you go there and tell, you don't have to worry, you don't have to worry, you all are here, we are here for you? Can we do that, giving false hopes? No,
No,
we
ma'am.
can't.
No, ma'am.
Yes, it is. To a certain extent, it is their own problem. It is to a certain extent we can understand their problem, but not fully. So instead of giving false hopes, what if we are dealing with an uncurable condition? What if we are dealing with the financial conditions of the patient? Can we go to them and say, "Don't worry, we all are there for you"? Can we do that? Just please
No, ma'am.
don't give false hopes to the patient. Instead of that, we can say that, if the patient is having pain, we'll make sure that you are not suffering in pain. That we can do. That we can make sure that the patient is not suffering, not going to suffer in pain. That we can do. So instead of giving false hopes, always give realistic hopes. Yes. Next, is communication difficult? As professionals, as professionals, we'll be having our own issues. We'll be having many patients, not one. So we'll be having all these, shared stress. We'll be having problems at home, work stress, our personal issues. All these issues will be there, and this always will come, putting pressure, distress on us. And also, we don't know if the patient asks what is going to happen, or we don't we if, whether if even we do know also, we don't know how to express it, we don't know how to talk about it. And also, it is, if I say, as a professional, I go to a patient and I say, this you are having cancer, and it is, you are in a fourth stage. If I am telling like this, what if the patient puts blame on us? Is it because of you I got this disease? It is because of you. It is not, it is because you are not good enough. I can't cure it. It is because of you I can't be cured. It is all these kinds of blames, criticisms. We are actually, as professionals, we also fear all these things, and not getting enough time. And also, we were worried about patient, if we tell this information to the patient, how the patient is going to react. Is he going to cry? Is he going to get angry? We don't know how. If the patient get angry, what I'm going to do? We don't know what to do. Are we trained to handle these kind of situations?
No, ma'am.
No. We don't we are we, there are, in our academics, there are communication and all there are, but we don't know. Actually, it is not structured for a structured thing that we have been taught. So it is, we don't know how to, we are not trained to handle this kind of reactions. Okay. In patient's view, why is it difficult communication? Can anyone give their inputs? In patient's view, why is it difficult to communicate? Why they sometimes they'll be avoiding. Like if in IP we'll be going to patient and be starting to, these things are there, and when we started to talk, they'll be like, I'm a bit drowsy now, I'm very tired, I'm taken these medicines, I don't want to talk to you. So this happened actually. So why is that? From patient style, why this happens?
मैम पेशेंट जैसे सोचता है कि ये डॉक्टर्स है, मेडिकल है, तो मेरी प्रॉब्लम को मतलब बहुत उससे नहीं सुनेंगे, मैं अपना पूरा सुनाऊंगा तो ये उसको इमोशनली मतलब नहीं लेंगे, और हो सकता है कि मेरी इतनी सारी प्रॉब्लम सुन के ये डिनाई कर दे, मुझे रखे नहीं, भेज दे आगे कहीं और। मतलब उन्हें एक फियर होता है कि हम लोग उन्हें इफेक्टिवली सुनेंगे नहीं और समझेंगे भी नहीं, तो इसलिए ज्यादातर टाइम वो अपनी जो फिजिकल से अलग जो प्रॉब्लम्स होती है उनको वो छुपा लेते हैं, मतलब अपने इमोशनली हमसे इतना इंटरेक्ट नहीं कर पाते हैं। और दूसरा प्राइवेसी का भी होता है उन्हें कि मैंने इन्हें बताया कि मुझे ये ऐसा है कुछ है, तो डिस्क्लोज ना हो जाए या किसी और को ना पता चले। हो सकता है कुछ ऐसी सिचुएशंस होती है मैम कि उसने अपने घर में ही नहीं बता रखी हो, तो कि वो सबको पता चल जाएगा, मतलब वो ये सारी प्रॉब्लम्स फेस करके वो पूरी तरह से ठीक से नहीं बताते ये सारी चीजें।
Yes, it is like that. And Anu Bongwal, I hope I pronounced it correctly. Sometimes due to frustration of illness, yes, it happens. There's too much to take it in. And also the patient adapt denial mechanism is always if we tell, something like this first to the patient, they'll be, I don't have that. The first thing that comes is they denied. And also, yeah, as it just said in the slides, lack of time, privacy, and they're afraid of the truth. Sometimes they avoid, getting that information, to letting the get information in, they avoid the truth. And they're also afraid that if what if the patient says there is nothing can be done. We have heard that, nothing can be done. You are in the first stage, nothing more can be done. What if the doctor said so? What can I do? And I'm afraid that I might lose my control, my lose my sense of control over my emotions. What if I cried out loud? What if I cried out loud in front of the whole team, professional team? And the med speech, the medical jargons, they might not be understanding all these things. And also, one thing to keep in mind while having this medical communication, avoid medical jargons. As far as the the patient might be well educated, well, he or she might be a lawyer, CA graduate and all, but as far as the medical terms concerned, they'll be illiterate. So it is very important that we communicate in a simple layman language so they can understand. So avoid all these medical terms, medical jargons, and they can't. They'll be having that fear of questioning the professional and fear of death, and they always expect something will happen. There will be a medical miracle. I can be survived. Even when after the communication happens and all, then also they can have that that expectation that I can be survived. Okay, we all we have come to an end. So if till here, anyone having any doubts, any clarifications on anything? Any comments that you have to make? Do you want to make any experience like this? Anyone wants to share any experience? Okay, so we all have been trained in history taking. in our degree graduate level and all, we have been trained, taught how to take history. But now I'm to add on that, by using all these communication skills, how can we take better history? So firstly, when the patient greeting is very important. Like when the patient comes to an OP, or we are going to meet a patient in IP, just greet them. Good morning, hi, hello, namaste. And make sure you have an eye contact with the person and smile. Even when you are wearing a mask, make sure you are smiling at the patient. And that's the first thing. And next, get each or both the patient and the doctor yourself, make yourself comfortable. And if you are going to meet a patient in the IP, and he or she is lying down, pull out a chair and sit in the bedside. Make sure that there is a equality. If the patient is standing, you can also stand. If the patient is sitting, if the patient comes to an OP, you can ask him to take a chair and sit down. So make both the patient and yourself comfortable. And then first thing, they just start the interview with an open-ended question. This is how can I help you? What brings you here? How are you today? If we are meeting a patient in IP, go to the patient and ask, how are you today? How are you doing today? Then, after asking these questions, the patient will start to talk. When we asked, how are you today, the patient will start to talk. This thing happened. I'm having pain in this. So when the patient is talking, listen to the patient carefully. Do not interrupt in the middle. Just be there with the patient and listen what the patient is saying. Next, encourage the patient to talk. We can encourage, while the patient is talking, we can encourage the patient to talk. Like maintain the eye contact throughout the conversation, from starting to end. Maintain the eye contact and nod your head. That makes a sense to patient that we are listening to them. Nod your head and make encouraging sounds like okay, carry on, like these kind of sounds that you can make, so that the patient will be encouraged to talk. And also, if you have any doubts, or if you don't hear something clearly in between, we can stop the patient and ask, what did you say? I didn't hear properly. You can directly, you don't have to wait till the end to ask for clarification. You can then there itself you can ask for clarification and clarify it, and you can you can continue with from there. And also ask, after asking all these things, and then you have to ask what the patient knows about the situation, what his condition is. What do you know? What the report says? Do you know what your condition is? What the doctor told you? Now, it is important that the patient to know what the patient knows about the condition. Then they'll be saying that I know patient, the doctor said these things. After that, and you can ask, do you have, what is the major issue that is concerning to you? What is a major problem? What are the things that troubles you? Okay, ask about their concerns. Then, if the patient shared their concern, whatever information share it honestly. Honesty is the key point. If you don't know anything, if you the question asks something, and you don't know anything, you don't know anything about anything regarding that, you can say that also. I don't know this thing at this point. If you want, I can talk to another doctor, and I can share the information later on. Honesty is important. If you use a simple language and no medical jargons, do not use any medical terms. Even if the patient is very well qualified, also just layman language. You make sure the patient gets the information honestly. And after this, we can also discuss about the treatment options. And these things are the things can be done. This surgery can be done, and this can be the medicines you have to take, and also this side effects can happen. These are the pros and cons of the taking these medications. After this surgery, you will be having this kind of problems. Discuss all these things, discuss about all these treatment options. And after that, again asked them, like, do you have any any more concerns, any problems that you want to share, any more beliefs that you have. And after that, after asking that, then again go to this with the consent from the patient and the family and your own opinion, make a decision what can be done. By three of us must be in that decision, must be part of that decision, and take that decision. And you can then go to summarize the interview, like starting from the beginning. You have told me about these problems, and your diagnosis is this, and you are be having where you're come to a point, this is a treatment that you are going to take. Like that, summarize from the starting itself, summarize the whole interview, all the consultation process. Then you have to what is the treatment plan. Once again, you have to confirm what is the treatment plan that you are going to do, and fix a date for the next visit. And after before leaving, ask the patient, like, is there anything else that you want to share? Ask you say you want to ask anything else. Always ask that. And close the interview by leaving the door open, which means do not simply let them go. They always give them a number, so that so they can contact you, and so they'll have something in their hand before leaving. So always leave a contact number. If you don't have to give your personal number, you can always give the hospital number, IP for call number and all. So always give something. They don't have to go barehanded. And from leaving also, you have to greet them, make eye contact and say see you next time, and greet them properly and say goodbye, bye bye, and they'll be going. This is the history taking that based on our communication. And adding to that, what we have it is been added to what we have been doing. So add this will create a best history taking, and it will again lead to a diagnostic accuracy. Okay, these are the basic things that we have to keep in mind while communicating, and we'll be having more sessions about breaking the bad news and collusion, and we will be learning more about in the later on sessions. And what does it in communication is a team sport. It cannot be handled in a single way. So all the team members should be aware of what we are going to talk and all. So it is a team sport. And empathy is an experience that your empathy should reflect on how you are behaving with patient and family. And the patient is always going to remember how you made them feel. Even if they have forgotten about the treatment or the procedures also, they'll always gonna remember how you made them feel. So listen to them, be a good listener, and be a and also communication is not an inborn talent. It is a learned skill. You can always learn how to be a good communicator. If anyone is having any doubts and any clarifications.
No, ma'am.
Any wants to share any experience that you have done, a good communication, or you have been, struggled with having a struggled to have a communication with the patient?
मैम कम्युनिकेशन की प्रॉब्लम आमतौर पर उनमें ही आती है, जैसे सुनने में कम दिक्कत है, अदरवाइज कोई दिक्कत नहीं आती मैम कम्युनिकेशन में। ध्यान से सुनते हैं, वो बताते भी हैं, जितना हम ध्यान देते हैं तो उतना बताते हैं हम।
Okay. So you have been following all these things before also, which I have mentioned.
No, ma'am.
So what is the difference? And what you have been doing, and from later on, what is the change that you are going to make?
Ma'am, from these points, now we can better communicate with patients and their problem.
Is there anyone else who wants to share?
मैम इसमें हमें ये भी पता लगा कि कम्युनिकेशन वर्बल और नॉन वर्बल दोनों तरह से होता है। तो जैसे आपने टच का बताया तो पैलिएटिव केयर में एक बड़ा अच्छा रहेगा ये, हम इसका यूज करते हैं तो।
डॉक्टर सुनीता,
हाँ जी मैम।
okay, you finished talking or you are
नहीं
interrupted?
कम हो गया मैम, खत्म।
Okay, yes, as you said, the non-verbal communication plays a bigger role than than the verbal communication, and also touch. Yeah. Any doubts, any clarifications regarding anything?
How to deal angry patient?
Sir, you were saying something?
Can you repeat the question?
How to deal angry patient?
Okay. With angry patients also, if when we are communicating with patient, when we are breaking a bad news, we'll be, dealing more within the breaking the bad news session. And also, if we are telling that you have a cancer, you have cancer, there are chances the patient might get angry. And sometimes give them time and space to express their whatever the emotions comes, to give them our responsibility is to give them space to flow that emotions. Even they are crying, even they are getting angry, even that some patients might get silence for a longer time. So it is from our part, what we can do is give them the space to flow that emotion, to vent out time have to be given. And after that, later on they'll be calming down, and then we can talk to them. These are the conditions. Some realistic things can be said after that, after this flow of emotions.
मैम समटाइम्स ऐसा होता है कि जैसे पेशेंट को हमने न्यूज ब्रेक किया, बताया, तो उसके बाद वो एक्सेप्टेंस नहीं होता उसकी तरफ से, वो मतलब उस चीज को एक्सेप्ट करने के लिए तैयार नहीं होता, तो वो क्या करता है कि मेडिकल वो छोड़ के वो फिर अदर वो ढूंढता है कि नहीं वहां मुझे अश्योरेंस दिया जाएगा, मैं ठीक हो जाऊंगा। तो ऐसी सिचुएशन में कैसे डील किया जाएगा?
Yes, that is very common. Like if the patient is not, that is also again again a problem of not having a good communication. The patient will go for hospital hopping and doctor shopping. Like they'll be trying Ayurvedic one day, the other day they will be going to some Unani medicines. This happens, if we are not communicating the patient communicating with the patient and family properly. We have to, when we are all these thing doubts will be cleared in the next session, where you'll be taught on breaking the bad news. So it is better if we deal with that later. It's all because of the lack of communication that happens. Anything else?
मैम एक क्वेश्चन पूछना था, जैसे किसी पेशेंट की जो रिपोर्ट्स है वो ये कहें कि कैंसर के लास्ट स्टेज में है, घर वालों को पता है, पेशेंट को नहीं पता, हम रिपोर्ट्स देखते हैं तो हमें जैसे घर वाले कहेंगे जी इनको नहीं बताना, तो उस केस में हमारा क्या मतलब कर्तव्य रहता है कि किस तरह से उसको हैंडल किया जाए?
Yes, as I said, in Western countries and all, the first the information is said to patient, then with patient knowledge we'll communicate with the family. But in our country, it happens like we'll first communicate with the family. The patient is having this condition, and with family's knowledge, if we tell him, do you want to tell this? Do you want the patient to know this? With family's consent only, we'll telling this news to the patient. That is when sometimes the family will be believing that they are protecting the patient. It is not like that, if the patient has every right to know, but it is important, at the same time, it is important, we have to have the consent of the family. We have the family must approve that now you can talk about this to the patient. Family's consent is important. As far as in Asian countries, we are concerned, the family is important. So we'll talk to family first. Then with their approval, we'll talk to patient. Before how many times patient asks also, we can't talk to the patient about anything. This consider family, we'll ask the approval from family, then we'll go for patient. And again, we'll get a clear idea about this in the later section, that is breaking the bad news, where we are dealing this. Okay.
Is anyone want another? Do you have any another questions, madam?
जी जी ना, मैं अब जाऊंगी थोड़ी देर में, 10-15 मिनट में मेरी खत्म होगी। अच्छा, इधर तो बैठी हूँ मैं।
So any other questions or comments that you want to make? And thank you so much for everyone being patient and being a good listener. Yeah.
Thank you, Anusree, for the wonderful session, and thank you all for the active participation. And I will be sharing a feedback link for you about the session. So I hope you all will submit your feedback. Okay, thank you all. Have a good evening.